You're feeling fine, right? That's when troubles hit hardest. What if feeling fine is your biggest warning sign? I'm Dr. Kiat. Let's go heart to heart. Last year, a colleague of mine in his 50s, he was fit, he was playing tennis, and suddenly he just collapsed. He was lucky his three tennis partners were also doctors. The CPR, hospital, emergency procedures to open the blocked artery. He survived his heart attack and back playing tennis now. And apparently, all three of his tennis partners booked themselves in for a heart check too. And last week, an executive, also in his 50s, came in for a checkup at his wife's insistence. He played sport, he kept fit, he looked healthy, but his test results turned out to be quite abnormal. He had serious heart problems, making him a prime candidate for dropping dead if left untreated. But that is how people collapse on the court, on holiday, in their sleep. These two real life cases I shared should remind us that prevention isn't an option, it is being responsible. Every checkup saves lives, so don't wait for a wake up call. That's healthy aging. Natural doesn't always mean safe. Many people think if it is natural, it's safe, but snake venom is natural, so is arsenic. And here's one you wouldn't expect. If you're a smoker and you innocently take vitamin A supplement, you know, the one that's very good for your eyes, your risk of lung cancer can jump up to 80% higher. I see the word natural thrown around in supplements like as if it is a guarantee for safety. It isn't. Supplements are often unregulated and their quality and quantity may never be tested. I always remind my patients to discuss their supplements, whether they're taking or they're about to take, with their doctor, the one with the medical degree. If this helped, hit subscribe for free. Next week, I'm debunking another health myth that could derail your healthy aging plan to retirement you cannot enjoy. Let's talk about copying your friends' health strategies. I often hear this. My friend did this diet and lost 10 kilos, so I'm giving it a go as well. Well, that's like borrowing their prescription glasses and hoping they'll fix your eyes. Your age, your genes, your hormones, your risks, they all shape what works for you. Healthy aging isn't one size fit all. Same thing, patients often ask me, Prof, what supplements do you take? But there's the thing here. What I take doesn't matter because I don't prescribe based on me. I prescribe based on you, your blood work, your risks, your goals. The real question isn't, Dr. Kiat, what do I take? The question should be, what's right for me based on evidence? That's the foundation of healthy aging. You need a plan built for you, not your podcast host. Always ask the questions. Does that apply to my situation, my conditions, my body, my mind, my needs? If you like the straight talk on what really works for healthy aging, subscribe for free. The topic next week could help you stay younger, longer. I like to talk about overloading on supplements and ignoring the basics. I've seen patients taking a dozen supplements every morning for just in case. A capsule for brain fog, another for energy, two for longevity, something for gut health. But when I ask them what they're eating, how often they move, or how they manage their stress, the answers are sometimes so vague they would make a politician proud. Here's the truth: supplements can support your health, but they do not replace the foundations for good health. If your sleep is broken, your diet is ultra processed, your body is stiff from sitting all day, and your stress is through the roof. There's no magic capsule to undo that. So before you load up on the latest miracle powder, ask yourself, what can I improve in my lifestyle? Am I moving enough? Sleeping consistently? Managing stress? Healthy aging isn't about your supplement shelf. It is nailing the basics. But if you are going to take a supplement, make sure you know exactly why you're taking it, understand the evidence behind it, track your progress with your doctor, and if it is not getting you closer to the goal, just bin it. So let's cut through this. Feeling fine is not enough. Protect your future and your family's future and get checked while you still have a choice. Natural doesn't mean it is safe. Respect your health. Talk to your doctor about your supplements. Always. Copying someone else's plan may not get you there and may be a waste of time. Build your plan with trusted professionals who actually know your body's story. Lastly, healthy aging is not about your supplement shelf. It is all about nailing the basics. Move with purpose, eat to nourish, live with less stress, and start today for tomorrow. One small change at a time, like going to bed at 10 p.m., may prevent big problems for tomorrow. If this all helped you to think differently, subscribe. I'm Dr. Kiat. Let's go heart to heart.